This year marks a turning point in the fight against RVCL, a rare, deadly genetic disease once considered unsolvable. But for the first time, there is real hope.
Patients with RVCL are typically healthy until around age 40 to 50, and then the disease begins. They begin to lose vision, they develop brain lesions, others develop neurological symptoms that leave them unable to walk or even talk. This progresses over the course of 5 to 10 years and results in disability and premature death.
Dr. Miner's team at Penn, with collaborators around the world, discovered the key.
In patients who have RVCL, they have one normal copy of TREX1, but they also have a second copy of TREX1 that moves to the nucleus of the cell and begins to attack the chromosomes. You can almost think of it like a knife in the nucleus, cutting chromosomes and leading to permanent damage.
When Professor Miner explained to us about this disease, the mutation caused it, and then I said, yeah, this is exactly what I was trained. So I told him, yes, sign me up. As a chemist, it's a dream for me to develop medicine that can help somebody's life.
2 labs, 1 mission. At the University of Michigan, Dr. Niamati's team would design the drug molecules. At Penn, Dr. Miner's would test them.
How do you make a small molecule that would prefer to go after the abnormal version of TREX1 while sparing the normal version of TREX1, which is essential? This is a challenge in the treatment of genetic disease that has never been solved until now.
The drug has to fit, just like a hand in a glove or a lock and a key, and it has to fit perfectly.
They pursued 2 approaches: drugs that block the mutant protein and drugs that tag it for destruction. Both target only the harmful version, leaving the healthy protein alone.
PROTACs utilize the cell's own machinery to place a label on the abnormal version of TREX1 so that it is targeted to what effectively amounts to be a wastebasket for proteins, causing them to be degraded or destroyed.
And what is really interesting, when we started making degraders or a PROTAC, we were surprised to see our PROTACs are actually selective for the mutant enzyme. Now we can use this technology.
In just 5 years, the collaborative effort has produced 2 lead drug candidates that have already shown promise in animal studies.
We now have proof that these drugs work in mice, and we have proof that they can distribute to different organs in the body. We never had that before this year.
Private funding made that possible. Now comes the critical phase: expanded safety testing, then clinical trials.
The support we've received is leading us to new technologies and new concepts that will benefit patients with RVCL, but additionally, these are principles of drug development that will be applicable for thousands of genetic diseases.
Selectively destroying mutant proteins without harming healthy cells. It's never been done before, and it has the potential to transform treatment for thousands of genetic diseases. 2 drugs are ready for trials. The impossible just became possible.